Hey guys, welcome to Simple Nursing mini lesson series. Today we're covering something that every nursing student and nurse needs to master. We're talking patient prioritization, or as we like to say, who do you see first? Or who's going to crash fast? And who can wait? Whether you're preparing for the NCLEX, already on the floor, or deep in clinicals, this skill is essential, and it's what separates a task doer from a critical thinker. At Simple Nursing, we know prioritization can feel downright overwhelming at first. That's why we've created clear, easy to follow frameworks and real world examples to help you build confidence fast. Our animated videos, NCLEX-style quizzes, and study tools break down complex topics just like this into simple, memorable lessons that actually stick. So today we'll be walking through must-know rules, real clinical scenarios, and a few tricky questions that you'd likely see on your exams, giving you the edge to answer with confidence and act with clarity. All right, now let's jump in. First off, what is patient prioritization? Well, prioritization is all about making smarter, quicker decisions on who needs your immediate attention and why. It's not just about the loudest patient or the one who complains the most. It's all about clinical reasoning, safety, and thinking like a nurse. Prioritization is the foundation for good nursing care. Without it, things get chaotic. And worse, people can get hurt or even die. So, the three big models to guide your thinking. We're going to cover the three key frameworks nurses use to decide who comes first. So, be sure to write these down. Number one is nursing process, ADPIE. This is your thinking map. ADPIE stands for A for assessment, basically what's going on right now. What are the facts? D is for diagnosis. Ask yourself, what do I think the problem is based on the data? And P is for planning. What do I want to achieve and what's my goal? I is for implementation. What am I going to do right now? And lastly, E is for evaluation. Did my action work and what's coming next? So, why does this matter for prioritization? You can't just skip steps. For example, if a patient looks short of breath, you always must assess first. This means listening to lung sounds, checking their oxygen, and really figuring out why they're short of breath. You don't just throw oxygen on them blindly or call a doctor without knowing what's really going on. Each option on an exam or in real life usually fits into one of these three steps. Understanding where you are in ADPIE helps you make the right choice. Number two is Maslow's hierarchy of needs, where we prioritize basic needs first. So, Maslow's pyramid teaches us that people have layers of needs. You can't focus on emotional support or education if the person's basic survival needs aren't met. So, let's cover the levels from bottom to top. At the bottom or the foundation is physiological needs. This means airway, water, food, shelter, and even sleep. These must be met first. Once these are met, then we can move to safety needs, like protection from harm or a stable environment. Now, once that is met, then comes love and belonging. We're talking relationships and emotional support. Next is self esteem, confidence, and respect. And finally, at the very top is self actualization, personal growth, and really reaching full potential. So, in nursing, if a patient is struggling to breathe, fix that before worrying about their feelings or teaching them about their diet. Now let's move on to number three, the ABC priority framework. This is airway breathing and circulation, which is the quickest rule of thumb for emergencies. So starting with airway, the question is, can they breathe? And is the airway open? Now what about breathing? You always want to ask, are they getting enough oxygen? And then last is circulation. Is their heart pumping enough blood? Anything threatening these systems takes top priority. So, for example, let's say we have a patient with wheezing and 89% oxygen saturation. Well, this patient comes before a patient with chest pain who is stable. The key term is that they're stable. So, again, think about the ABCs. Airway and breathing come first, and then C for circulation comes next. Now, for bonus tips for prioritization, you can also write these down. First is acute problems always come before chronic issues. Next is actual problems come before potential ones. If someone's actively bleeding, well, that beats a possible fall risk. Next is unstable patients always come before stable ones. And lastly, start with the least invasive intervention first and then escalate to the most invasive. So, how do you decide in a real scenario? Well, let's keep it real. When you're overwhelmed, always think, what's going to kill this patient first? Or who dies first? That one question alone will focus your brain, even when 5 alarms are going off. It's not about being mean or being cold, it's all about triaging and being the best nurse that you can possibly be and keeping your patients alive. So let's apply what we've learned to a few NCLEX-style questions and break down the rationale behind each question. So question number 1, you're the nurse on a busy med-surg unit. Who do you see first? Go ahead and pause the screen and look at the list of options here. All right, let's break it down. Would it be patient A, a diabetic with blood sugar of 42 and slurred speech? All right, well, we know that hypogly, the brain might die. This patient can slip into a diabetic coma and they could die. What about the next one? Post-op hip replacement patient with 8 out of 10 pain. Well, pain is not necessarily first. So what about C? A COPD patient with an SpO2 of 90% on 2 liters of oxygen. Well, for clients with COPD, they typically have lower oxygen levels, so this is normal. And how about the last one? An anxious patient asking to see their chaplain. Well, that's not a physiological need. That's more psychosocial. So the best answer option and the correct one is answer A. The blood sugar of 42 with neurological changes, that's slurred speech. This patient has a huge risk for a seizure and possibly losing their airway in a diabetic coma. So always remember, ABCs first and who dies first. Now let's move on to question number 2. Which pregnant client do you prioritize? Go ahead and pause the screen and look at the options. All right, let's break it down. Would it be option A, 9 weeks with severe nausea? Or option B, 14 weeks with urinary frequency and pelvic pain? How about the next one? 22 weeks with increased fetal kicks? Or option D, 34 weeks gestation with nausea and constant epigastric pain? Well, always ask yourself, who dies first or who's at most risk for harm? Well, in this case, the answer is D. The epigastric pain could mean preeclampsia, fancy words for high blood pressure, which could risk the pregnancy. This is actually a sign of liver involvement and possible seizure risk. So remember, epigastric pain could indicate organ failure warning in late pregnancy. All right, now let's move on to question number 3. Which action comes first? Go ahead and pause your screen and choose the best option. Okay, let's break it down. Would it be option A, review AM labs for potassium sparing diuretic? Or option B, administer sliding scale insulin, blood glucose of 350? Or C, report a hemoglobin of 12.5? Or would it be the last option, D, admit elective hip surgery patient? Well, again, always think who dies first. The correct answer is option B. That blood sugar is way too high. 350 puts the patient at risk for DKA, a deadly diabetic condition. We're talking metabolic acidosis, coma, and eventually death. Everything else can wait. All right, hopefully you guys are getting the hang of it. Let's move on to the 4th question. A client is 15 weeks past their last medroxyprogesterone shot. What is your priority? So again, pause your screen and choose the best option. All right, the correct answer here is answer D. This medication is teratogenic, meaning it could risk a pregnancy. So you must rule out pregnancy before re-injecting. Otherwise, you can harm the fetus. Now lastly, question number 5. Let's go into a psychiatric emergency. So which of these patients would you see first? Again, pause your screen and try your best. All right, let's break it down. Would you see the first patient, ADHD teen who hasn't slept in 2 days? Well, this patient does not have a huge risk of dying, but the lack of sleep could definitely cause harm. What about option two? Bipolar adult on lithium with vomiting. That could lower their sodium and put them at risk for toxicity. How about option C? Risperidone user with altered mental status, fever, and muscle rigidity. All right, that one sounds life threatening, and it sounds like NMS, neuroleptic malignant syndrome, which is a life threatening emergency, and the patients could die. Now, what about the last one? Suprazidone user with blurred vision and thirst. That could be toxicity, but again, the most life threatening here is option C. So it's the correct answer. Anytime you see a client taking risperidone with altered mental status, fever, and muscle rigidity, you gotta think NMS, neuroleptic malignant syndrome. Again, this is a life threatening emergency, and we talk about it a lot in our pharmacology mastery series, which is located at SimpleNursing.com. So, again, a quick tip: if you see fever, rigidity, and the client is on antipsychotics, you gotta think NMS. All right, now for a quick recap for the most tested topics that love to come up on exams. We covered the prioritization checklist. We're talking ABCs, always ask who's losing their airway, oxygen, or blood. Next is Maslow's. Remember, physical always comes before emotional, and acute always comes before chronic. Actual problems come before potential problems. Unstable patients always before stable patients. And then lastly, when in doubt, always ask what's going to kill them fastest, or which patient dies first. These rules will carry you straight through the NCLEX, clinicals, and in real life nursing. Thanks for sticking around with us through this patient prioritization mini lesson. Be sure to check out the interactive NCLEX-style practice questions only at SimpleNursing.com. You can simply click the link in the description below. And if you want more videos like this, well then hit the subscribe button and check out our other mini lessons built to make complex nursing topics actually stick. And as always, please like, share, and subscribe. See you guys in the next videos.